What I'm here today, what I've been asked to do today, is to talk primarily about compression, which is, I think, what is given to many people who are diagnosed with lipedema. But whether they get on with it or not is a different kettle of fish. It's a really difficult process. I mean, those of us who've worked in lymphedema, we've probably got the knack of how to measure patients, but lipedema is different. Your tissues are very different. And therefore, it does take expertise, experience to get a really good pair that fit you correctly. But I just want to talk a little bit around it. This is not lipedema. This is what I first sort of came across and what Anne would have come across all those years ago. I started in the late 80s with my lymphedema work in the Midlands. And we got really good results with the traditional treatments that we did. This is a cancer-related lymphedema patient, and you can see good reduction there after just a few weeks of treatment, including compression. What I didn't understand was why I didn't get the same sort of results for this type of patient. And in those days, I had no idea why not. But gradually, as time moved on, we realised actually that this wasn't lymphedema, this was a different condition altogether, a condition called lipedema, which again, gradually as the years have progressed, we've learned to know a little bit more about it and what might help it. Over the years, I've become involved where I can in all sorts of different charities. Lipedema UK is one that I worked very closely with in England. More latterly, I've started working with the International Lipoedema Association, the ILA. And what I've learned from all of that is that when we meet people, like we've already talked about this morning, the important thing for the first meeting is to actually get a diagnosis. What is it that we're actually looking at here? Is it pure lipedema? And I have to say that what I'm seeing these days, as a result of all the work that you guys have been doing in Talk Lipedema and Lip UK, is that we're seeing people much younger. We're not seeing those that have had this for years and years and years, which is so nice to see. We're actually able to fit compression on people that have not got the issues that some of you have. But of course, still some come through the door. But it is important that we give a good assessment, that we listen to you, listen to what you need and what we can do to help you in return. It's about a team effort. We've got to work together, and I think that's really important, that we don't have a magic wand. We're not going to be able to say, there you go, it's all sorted. These are the tools that are going to help you. We can help you, we can advise you, we can support you, but you have to do the work too, unfortunately, and I can't stress that enough. But hopefully your team who are helping you, and of course the support groups that you work with, will achieve that. These are the components of lipedema management that we approach mostly. Again, holistic and therapeutic approach, a good assessment, but it also incorporates the other managements that we do in lymphedema too. We're looking at psychological support. We've talked about that a little bit this morning. We've talked about weight management. We talked about trying to optimize daily function and physical activity, exercise, if you will. And compression therapy too is important, but it's not the be-all and end-all. It's about working with that as part of a component of care. Compression, of course, comes in different guises, doesn't it? And you may already have seen, perhaps looking at the stands today, already know of different types of compression that we use in lymphedema particularly, but perhaps sometimes in lipedema. You may have come across bandages. Now, in my experience with lipedema, we don't tend to use them a lot, mainly because the bandages that we use are to remove fluid. So if your lipedema does have an element of edema within it, that will help with the bandaging system. But if it's a pure lipedema with just fatty tissues, we're not going to get a reduction with a bandage. What it may do, though, for those who are unable to tolerate a compression garment, is that it might help relieve some of the pain or the discomfort that you're experiencing. But you're not going to get a magic cure from a bandage, I'm afraid. What about wrapping devices? And again, I saw a couple of those on the stands today. Again, we use them quite a bit in lymphedema management, but not so much in lipedema. Again, it might be suitable for those who are unable to tolerate normal compression in the form of a garment. Self-application is possible, and that might not be something that you can do with a compression garment yourself. So it might be something for you. And again, everybody is different. So our job as a clinician is to try and gauge what is right for you, what will work for you. What's the answer to help you to get on with your activities of daily living and to live a normal life as possible. The other thing I have used, though, with my lipedema patients is intermittent pneumatic compression therapy. We call it ICP for short, and again, we use it in lymphedema. You can see there's a lot of things that we use in lymphedema that we've started to use in lipedema. These have really come on over the years, and early days we didn't like them very much because they used to displace fluid. And you think, well, why are you talking about this again when we don't predominantly have fluid in our tissues? But what I'm using it for is to help with the discomfort element that a lot of you have, the pain, the tenderness, and sometimes some of you really can't tolerate any form of compression at all. Whereas applying this, we can turn the pressures right down, and just by gradually increasing them, you start to begin to tolerate a compression garment. So they can have really good uses in lipedema management. So it's something, again, for you to consider perhaps moving forward. Kinesiotaping, we can see David Beckham there. I'd love to have him in my clinic someday, but unfortunately he hasn't visited yet. We use it a lot in sporting clinics, but we also use them in lymphedema clinics too. But for some patients with lipedema too, it's been helpful for some. Useful perhaps, again, when there's a fluid component to the swelling, when compression can't be tolerated. It can help with pain and discomfort too. And it can help really with its supporting tissues, again, predominantly when compression in its traditional form can't be used. So I've had some success with this too. And again, another option for some patients where we've tried everything else. So what are we really looking at then? What will help with lipedema? Compression garments, of course, are the basis. That's the one thing that we use a lot of in lymphedema as well as lipedema. And again, I can't emphasize the importance of your therapist knowing what they're doing. They can get it wrong so easily. It's not easy to measure a lipedema patient in regard to their compression. A lot of the companies here have got huge skills in helping clinicians to raise their experience and expertise. But what it does, what it can do, in my opinion, is to reduce pain and discomfort greatly. That's the primary use, I think, of compression. It's not going to make your legs any smaller. It's not going to magically decrease them overnight. But it might, because of their anti-inflammatory effects in the tissues, and again, there's not a lot of evidence about this at the moment, but we think that's how it works, that some of the pain and discomfort you experience will reduce by wearing good fitting compression garments. For me, they also help to improve the limb shape and contours, so they streamline the legs. And as Stuart just demonstrated there by walking, you found that it's very difficult to walk normally when you have got swelling like that. It alters your gait, your posture, the way that you move. By streamlining them, you're going to move a little better. So compression really can help.
It's gone off. Keep going.
Again, what compression doesn't do is to reduce the shape or size. So again, it's not a magic wand for your shape, for your lipedema. It's not going to magically reduce it, but it can help significantly. The types of compression used will depend on your shape and size, and there's lots of different garments, as you'll have already seen and have probably come across already through the garment companies that you've seen. This is what we don't want to see, and this is what I see often with many patients. Somebody talked this morning about seeing their GP and then being sent to the treatment room and being measured by somebody. They've not got experience in measuring you for lipedema. You need to have really good skills in doing that. This is not what I want to see, because if you've got garments that look and feel like that, they ain't comfortable and you're not going to work with them. They're not going to work for you. So you need to get them changed, and you need to look at something that is appropriate for your particular needs. This is a patient of mine who had not great lymphedema, and again, as I've intimated earlier, we're seeing patients who are getting less and less of those large limbs that some of you have experienced because of the late diagnosis. But this particular patient had huge problems with pain and discomfort. It stopped her doing what she really wanted to do. Skiing is one of those things that she loves. But by wearing good, appropriate, well-fitting garments that are supportive, comfortable, it's helped to reduce the pain that she had. And as a result, she can do the things that she wants to do now, including the skiing, which she so loves and is wearing there, that you can see in that photo. So it improves quality of life, no end. But again, education is so important for those that are measuring for it. These couple of slides show you some of the info that we got from Lipoedema UK way back in 2012. Gone again, I think, hasn't it? Basically, we were asking the membership, what treatments do you have to help your lipedema? And almost there, you can see almost 80% said that they were using compression therapy. But when we asked them about it, only 38% were actually wearing it. So what about the rest of them? What was happening to that? Well, thank you. As we learned through that, we found that most of the garments that people were issued to were really uncomfortable. They were so uncomfortable that they were just languishing somewhere in the bottom of a wardrobe somewhere. They felt that the garments were hot and itchy, especially in the summer. And actually, most garments actually are, aren't they? There are not enough supplies given. So there was lots of problems that people were experiencing in regard to the compression that they were issued with. A lot had problems because they were a poor fit. The material was digging into the creases and folds, as we've seen in the previous slides. They were rolling and tourniqueting at the top of the thighs if they were just stockings rather than tights. And they were causing pressure points and wounds. So, important factors then, when we're looking at fitting you with garments, is these. We need to be really looking at you as an individual, working out what it is that you would like to wear, what would benefit you in your everyday life, and as a therapist, what we can guide you, what would be the best type of garment for you. Until recently, there have been very few products specifically designed for lipedema. Most of them have been brought up for venous products that we've adapted slightly for lymphedema. And now we're starting to see them being changed slightly for lipedema. But we've got a long way to go. And it's about us, a therapist, and you, the patients, talking with these companies to try and get something that is right for you. Because I don't think we're there yet. We've got some really good products that are really helping, but we've got a long way to go to make those garments comfortable for you to move around in, that you do feel that you can wear in the daytime, that you do feel that they're easy and not hot in the summer, that they're breathable, that they're manageable, that they can become part of your everyday wardrobe, that you're not just limited to a couple of pairs on the NHS, that you can get more supplies that fit you, that after a couple of prescriptions down the line, they're totally different and they don't fit you anymore. We've got a lot to do, but I think we can get there if we can all talk together, work together and collaborate. So again, this is not what we want to see. We want probably, for many of you here today who've been undiagnosed for a long time, perhaps we do need to think about flat knitted stockings. These are made to measure garments that are custom made to fit you precisely. But again, the nurse or the therapist who's looking after you needs to know how to do this correctly. It's not easy. It's not something that we just learn overnight. Anne and I have had years of experience in doing this, and we still get it wrong. But majority of the time, we do win through. And with appropriate modifications, zips, etc., we can usually get a garment that is relatively comfortable. A couple of slides now just showing you patients that have had really good garments made. These are supportive and comfortable. It means that the patients can move around, they can do their activities of daily living. This woman here had most of her swelling in the thighs. It really limited her range of movement, her function, her range of movement. It stopped her dancing, which was something that she really, really loved. These hold-ups did the trick. They really helped the discomfort. She could move better. You can see how streamlined her legs are already. That immediately means that she can walk better, she can move better. And as we adapted them into her tights, she was able to go dancing again much more easily. So garments can be adapted for your use. These are made to measure. These are actually round knitted garments that I've adjusted accordingly to make them fit that particular patient, work for her. Here again, we've got this time leggings. Most lipedema patients do not have swelling in the feet, so we can get away with leggings. We can't do that with lymphedema because if we did, their feet would swell out of all proportion. So leggings in this case really helps with zips at the side, supportive, comfortable, promotes ease of movement, limb function, and reduces the pain. So compression needs to fit well and it needs to fit comfortably. And then you'll wear it and then you'll really start to reap the benefits. But are these types of garments that we see out there the thing for us? Are they right for you? I think we just need to start looking outside the box. We need to be thinking outside the box. What other products would work? What about those products that we use perhaps in sports therapy that are breathable, that are movable? You'll see a lot now more athletes actually using compression when they're running, etc. They can manage it, so why can't we adopt that into the lipedema management? Why can't we adopt the measurements and the sizing to make them fit us, to fit you, to make them easier for you to manage on a daily basis? Even leaner garments, body form, Bridget Jones type of garments, they're okay, but they're not right in the sizing elements for you. We need to get them adjusted. We need to work with them so that we can hopefully get them to work for you. An arm lipedema. No, has any of the companies out there got a good arm sleeve that it is appropriate yet? It's really, really difficult to get really good fitting arm sleeves. That's something that's totally neglected, I think, by the garment companies. But we need to try and find some that will help, not particularly, again, to reduce the size of them, but to support them, to help the pain within them, and to make them more streamlined. What about information on fitting the garments? It's all right giving you them, but can you get them on and can you take them off? That's really important too. Lipoedema UK found that a lot of people weren't given that information, but when they were, they found it really helped. Patient information is therefore really important too. The compression that we're talking about here is graded medical compression, and it can have an influence on your circulation. So we as therapists do need to know that it's safe for us to apply them on yourselves. So that again is something that's very important to me. You need to know when to remove them if there's a problem with them, because if that's cutting off your circulation, it may cause more problems than you've got already. So Lip UK did a lot of work in regard to asking their membership about compression. And I just wanted to pull a little of those points out just to share with you. Some of them were the problems experienced by patients with lipedema, and I think you'll probably relate to some of these that are on here today. Most of you will have had problems getting them. Most of them languish at the bottom of the wardrobe if you can't get them to fit. What a waste of money. The compression garments, the leggings, the tights, how much, Stuart, would you reckon they cost if they're not on prescription? Over £100? Easily. Yeah, hundreds of pounds. So if they're languishing at the bottom of the wardrobe, what an absolute waste of money they are. So they need to fit you. So important. Many talked about how difficult it was to get them in the first place, the length of time, how the pharmacists struggled to get them to you, problems with codes. I don't know what it's like here in Scotland, because obviously I don't work here. But we've now got around that by talking with our local pharmacists, and there's a lot of them. But it's still very, very confusing for most of the pharmacists to actually get the products that you have been prescribed. So it's something that we really need to address quite urgently, I think. The compression was used by many more people following the more later research. Patients in 2012, they hardly wore them at all. But in 2018, we found that around 50% of patients were actually wearing them every day. So that was a huge improvement. So we have, I think, started to really help our patients over time. And we found that 78% of the respondents actually felt that they helped improve quality of life too. So whilst there's not a great deal of evidence about whether they help or work, I think patients themselves are actually saying, yes, actually, they do help, particularly if they're good fitting. There were many negative comments about the compression, but there were also a few positive ones. My legs feel lighter and less painful. It's hard to describe. I'm so used to wearing them all the time now that they feel normal, and not wearing them is easier to describe. Without them, my legs feel heavy, tender, painful, loose, ugly, vulnerable, and above all, tired. I could not carry out my usual walking and day-to-day pursuits without wearing the tights. So positive comments from many. There were challenges though that were pointed out, toileting when you're wearing tights, how difficult it is to remove them, to get them down. But again, they can be adapted, zips can be put in them to make that easier. To stop them rolling, we need to have a wish list, I think, from you. What would you like to see from your garments? That's the sort of stuff that Stuart wants to know. I'm pointing at you because you're the one that's nearest to me. But by you feeding back information about your products, he can then take that back to the powers that be. He can't do anything about it, but he can report it. And it's only by a collective voice that we can start to make an improvement in the garments that will help you to manage your everyday life. We need larger sizes for those off-the-shelf garments. We need better fitting leggings, smaller waists, because of course the larger the garment, the larger the waist. So many of you, they wouldn't fit you. So we need a lot more. We've got a lot more colour and styles now out there, but we need a lot more that actually fit you better and that work for you on a daily basis. So suggestions, recommendations, we need to improve the garment sizing. We need to develop specific garments that are fit for purpose. We need improved yarns and fabrics that are breathable, more fashionable, comfortable to wear, lighter weight perhaps, offering flexibility and facilitating movement. We need to look at garments for post-liposuction too. Alex, of course, if you, some of you know him, he gets his garments for you, but many patients that I come across in England, they're going abroad. They're going abroad for surgery and they're not getting their garments. It's a total waste of money. So this needs really taking on board, and particularly those in the UK, the surgeons in the UK are the same. We really need them to take on board that compression post-surgery is so very important. So lots of education required, I think, for healthcare professionals, measuring and adapting compression currently available, easier prescription detail and protocols, and help, of course, for dispensing surgeries and pharmacies on actually prescribing them. Remember, compression is just a part, a component of care that you'll be offered, hopefully, for your lipedema management. It's about moving more, and if you've got good compression, you are going to move more. If you can move more, that will help your weight management, which in turn needs addressing, but so does your psychological support and good assessment, of course, right at the very beginning. You might then meet Alex or other surgical interventions. You might not. But it's a package of care that we need to look at that is right for you individually. I want to thank the International Lipoedema Association. I've learned a lot from them. I've learned a lot today from you guys, that's for sure. And also for Lipoedema UK, who I've worked with in the past, for their ongoing work and dedication to improve the care and hopefully improve what you guys are offered today. So thank you so much for listening.